Skin antisepsis is one of the main infection prevention techniques to minimize the risk of contamination of the site prior to a clinical procedure. During the skin antisepsis process, the objective is to disrupt and remove as much of the transient flora in the epidermis of the skin as possible and reduce the number of microbes present. The U.S. Centers for Disease Control and Prevention and the Infusion Nurses Society both reference the use of an alcoholic chlorhexidine solution for use of the prevention of intravascular catheter-related infections. Your facility has chosen the Prevantics 1.6 milliliter Swabstick, used for preparation of the patient's skin prior to surgery or injection. This single-step, broad-spectrum persistent antiseptic significantly reduces the number of microorganisms on intact skin. The Prevantics solution contains a 3.15% chlorhexidine gluconate and 70% isopropyl alcohol formulation and is clinically proven to have continued antimicrobial activity for up to 7 days. Prevantics Swabsticks have a maximum treatment area of 4 inches by 4 inches for dry sites and 3 inches by 5 inches for moist sites. Prevantics Swabsticks also feature a unique two-sided applicator, perfect for prepping around joints, interdigital areas, and skin folds. All Prevantics applicators are latex-free, contain no glass, and are pre-moistened for immediate use. The following section provides step-by-step instruction on product use techniques, procedures, and protocols necessary to ensure proper compliance. When using the Prevantics Swabstick to prep and disinfect the skin, be sure to wear gloves according to facility protocol and always follow the instructions for use on the package. Step 1. Opening the package. To open, peel apart the pouch and expose the Swabstick. Remove the Swabstick from package, making sure not to touch the foam tip. Step 2. Applying the Swabstick. To apply the Swabstick to the proposed skin site, place one flat side of thumb tip to the skin and prep the skin in vigorous back and forth repeated strokes for 15 seconds. Turn the Swabstick over to the unused side of the foam tip and repeat the previous procedure by prepping for 15 seconds. Allow the prepped area to air dry for 30 seconds. Do not blot or wipe away. Step 3. Disposal. Dispose of used Swabstick after a single use in trash or in accordance with your facility's regulations for infectious waste disposal. When using any skin antisepsis, there are precautions to consider. Prevantics is for external use only. Isopropyl alcohol in Prevantics is flammable. Do not use with electrocautery procedures. Do not use on patients with known allergies to chlorhexidine gluconate or isopropyl alcohol, for lumbar puncture or in contact with the meninges, on open skin wounds or as a general skin cleanser, or under occlusive patch. You must allow the area to dry prior to procedure, making sure there is no pooling on the skin. Prevantics Swabsticks have a 2-year expiration date that is stamped on the product packaging.